Welcome, homies and homettes, and welcome to another video of the Kevin Strong Show. And in this video, we're going to talk about the American medical crisis that's happening. We all are affected by this, whether you're young or old. We all are experiencing a higher cost and less access to quality healthcare in the United States. We're going to briefly talk about that. I'm going to show you a chart, an interesting chart that's going to blow your mind, that shows you the rising cost of healthcare as it relates to your age. Stick to the end of this video. We're also going to do a little bit of a YouTube video about this guy I've been following that talked about this fabulous experience he had getting a checkup in Malaysia. So welcome to my show. If you're new, start off by doing me the honor of subscribing to the channel, smashing that like button. So without further ado, let's go ahead and jump into this. This is going to be very, very interesting. And I do have my own editorial comments at the end. So let's go ahead and tee this baby up. And I'm calling this the healthcare meltdown. Let's go ahead and jump right into some of the data. So let's start off as contrary to popular belief, one of the main reasons why Americans file bankruptcy is because of medical bills, inadequate medical insurance, or flat out they get bills that they just can't pay. 2/3 of people who file for bankruptcy cite medical issues as a key contributor to their financial downfall. It is paramount that you take your health seriously. While the high cost of healthcare has historically been a trigger for bankruptcy filings, the research shows that the implementation of the Affordable Care Act has not improved things. It's going to get worse before it gets better, in my humble opinion. I think the healthcare system in its entirety, as it relates to the United States, is broken. What most people do not realize, according to one researcher, is that their health insurance may not be enough to protect them. How many times have you thought that you had adequate or excellent health care, only to find out when you're faced with an illness, the policy doesn't cover it? Sounds a little bit like insurance a little bit. Researchers found that 66.5% of all bankruptcies were tied to medical issues, either because of high cost or for care or time out of work. An estimated 530,000 families turn to bankruptcy each year, folks, because of medical issues and bills, research have found. The average 65-year-old retiring today can expect to spend about $157,000 throughout their retirement, even with Medicare coverage. This is according to a study by Fidelity Investment. And for a married couple, the rate is $315,000. This does not take into account if you're on a fixed income with limited financial sources. As you know, if you're on a fixed income, that is a recipe for disaster if it's a low fixed income, because inflation will eat away at that. So here's a graph that I promised to show you guys, and we'll jump into this YouTube video. The older, the more you pay. Look how this thing kind of streamlines from basically from your teenage years all the way till you get to around that 30 to 35 year range. Once you basically get over 35, the cost, which is associated on the left, monthly cost, just skyrockets up. And when you get to traditional retirement age 65, your healthcare cost is about $1,300 a month. Hell, the average Social Security check is only $1,800, and you know you pay for health care with after-tax dollars. So that $1,800 Social Security check hasn't even been taxed yet. So for all practical purposes, let's just say, you know, your health care is absorbing over 85% of your Social Security check by the time you reach the age of 65. This is a growing problem. It's not going away. People who know me on a personal level, they know how serious I am about health. I don't care about how much money you got. If you're not healthy and you're overweight, you're missing the big picture. Don't brag. Don't brag to me about how much money you got at the bank when you built like a baker's dozen. That means absolutely nothing, because if you're fixated on money, which we all should be to a degree, not obsessed with it, but fixated on it, then the most opportunistic way to enjoy it is to make sure you have good quality health as you get older so you can enjoy that money that you're making. Nobody wants to have $6 million in the bank and have prostate cancer, or have all of these medical conditions that they got all the money in the world, but they can't enjoy travel because they're on medication and have all these other medical restrictions. Not to mention, if you ignore your health as you get older, then you move into all these pre-existing conditions and it just skyrockets, and it's just a nasty, nasty, vicious circle. So I'm going to go ahead and jump on this YouTube thing. This is a guy in Malaysia. They got a complete checkup for $300 US dollars. Watch how much and how far his dollar stretched for this $300 hospital appointment. And let's see here. This is freaking amazing.
Hey, and it's like the prices from like the Cold War era at this cafe. You get like a sandwich for $1. They give you like $5 to spend on lunch, and it really goes a long way. Anyway, there's different treatments here.
Check this out,
I
folks.
did the Wellman for above 40 years old. It's 1,500 ringgit. They give you 10% off as I sit here for using your MasterCard, and they charge you a 10 ringgit surcharge to register you. So total price 1,360 Malaysian ringgit is what I paid, and that came out to, at time of payment, $301 US dollars. Now, I did the research in the few minutes I had sitting there, because I was messaging all my friends like, you got to come and do this. I'm probably going to put all of our employees on this. I'm gonna bring them here to do this.
Wait for it.
Just getting the little where you're running the treadmill with the ECG on, I saw the average price in the United States was like close to $2,000 just for that one thing. And I'm sure you don't come in and get taken care of within 2 minutes and have executive level attention. So $301 for everything. At the end of that, 2 hours, you meet the doctor. She does the kind of a physical.
I'm gonna speed up and show you what some of the stuff you get for $300.
Asks monitoring, blood pressure, pulse, temperature. They do the tone audiometry to make sure your hearing is
all
good.
This is included for $300.
Vision testing, body fat analysis, like the most advanced machine ever. I went to stand on this machine, and it's like, all right, here's what you should do. All right, spoiler alert, I should lose a couple kilos. They do a lab test, fasting glucose. Okay, we'll just put it up here. There's some things, I don't know what most of this stuff is. Fasting glucose, uric acid, liver function. They basically test everything. Hepatitis B, HIV, full blood count, blood film, everything. And you can add extra stuff if you want to. Oh, I want to get tested for, put myself through the stress test. They do the radiological. You do the chest X-ray. They also put me on the bone and the spine examination.
Heart, bone marrow,
spine. They check your
all
bones.
this crap for $300.
They do an ultrasound, abdomen and pelvis, where they check all your different insides. Okay. And then they do.
So you get the. Let me go out of here. You get the point. So now I'm going to show you where the United States is in relationship to its healthcare system compared to other countries. This particular place is in Malaysia. Some of you have been following me a little bit. I told you maybe a couple months ago, or less than probably 4 or 5 weeks ago, that I was looking at Greece long-term retirement. That's off the board right now. Thailand is on a short list. I'm actually considering going there for about 30 days, July of 2024, just to check it out. And there's a couple other places that are on my short list, but I want to show you this international ranking for healthcare systems and where the United States is in relationship to other countries that you may think, from being brainwashed and listening to all the propaganda, that it's a third world country. And I would never consider going there. So let me go ahead and pull that up, share my screen again. Okay, so this is ranking the best healthcare in the world by country. This is by the International Citizens of Insurance. And I'm going to scroll down here and I'm going to stop. So obviously this is numerically in numerical order. I'm going to go down to number 31 here. This is Thailand. Okay, where's the United States? 69. So think of that. Albania, Jamaica, Bulgaria, freaking Armenia is ranked better health care. Unfreaking believable. So I'm going to go down here a little bit. Greece is at 41. Portugal's at 40. That's really famous. Mexico was a couple notches, I believe, below the United States. That's a very popular country that expats go to retire. That's at 71. I think healthcare should be a very, very key component in your decision if you decide to retire and or live abroad. And obviously, number one is Singapore, China, South Korea. You see the list here. Very, very interesting. So just wanted to bring that up to your attention. I thought that was very, very, very interesting information. So what I think, the only thing we can do as Americans is prevention. This is why for those of you who know me without sounding like a broken record, this is why I'm so hyper-focused on health. I just think it's indicative of your character, how you feel about yourself. You can't continue to abuse your body, retire, and then expect to live a quality life when you've abused. The system is not set up to take care of you. This is like freaking car insurance or insurance. We all know what thieves that industry is, right? They're always looking for something in your policy to say, see, we don't cover that. You thought you were covered, but you're not. So the only thing you can do from a healthcare standpoint, in my humble opinion, is preventive maintenance. Eat healthy, exercise, get regular checkups when possible. And finally, and I probably should have started off with this, this is something that hardly nobody talks about. Everybody brags about their freaking premium. Oh man, I got good healthcare coverage. I've got great healthcare coverage. I only pay $20 a month. Hell, for full disclosure, I don't pay anything per month for my healthcare. Okay, for my day job. But that's not the point. What's really the paramount issue when you're talking about healthcare? Having access to it. What good is it? What good is it to talk about or brag about how low your monthly premium is, but once you need to see a freaking specialist, you got to wait 3 or 4 months to get an appointment. So if you have an existing condition or an illness, that said condition or illness is manifesting itself between the time you go see your primary doctor until the time they say you can see a specialist. So now you are at stage 2, but hell, now it's stage 3 because you had to wait 4 to 6 months to get the diagnosis. That feeds into the problem because the system is broken. I know the example in Malaysia is not for everybody, but I'm telling you, more and more Americans are reassessing whether or not they want to stay in this country long term. And there are a lot of options outside of the US border that provide you lower taxes, better culture, and access to better quality health care. And you do your own due diligence or make your own decisions, or you can stay here and just complain, knowing that it's going to get worse before it gets better. I hope you enjoyed this edition of the Kevin Strong Show. Once again, please do not click off before liking this video. Hit the like button, subscribe, and hit the bell notification because once again, I typically release my videos once a week on Saturdays, Pacific Standard Time at 10 a.m. Thank you for watching. I hope you enjoyed this show, and I hope to see you in the next one.